have the patient lower their head. And again, you want to be perpendicular to the floor of the mouth.
Okay.
And then, unfortunately, this man's lost his tongue. But you would either grab the tongue, or again, I like to use a tongue depressor because you can flip the tongue up and you can just blanch that tongue. And I'll explain what that is. So you're looking here, make sure you pull the lips out and you're looking at this buccal mucosa, same on the top. And then you should be done. I'm pretty systematic about it. If you see something black, that's an example.
Okay.
Everything should be green, but if you see something black like that, again, it's unilateral,
So
not
like
bi.
that, but not that black.
Right, exactly.
So it's right. It'll be right in here.
Right, should be. And again, this is how the picture was taken, so that's not black, but that's a good observation. But that's the way it should look. Irregular border, unilateral, and doesn't blanch. Now, blanching is taking that cotton, see how I move the blood in my hand? That's blanching, and I always like to use, again, that tongue depressor to go across it because it's wide. And if you see the blood coming back, then you're probably fine. If you're blanching and it stays dark, you've got a problem. You've got something you need to be concerned about. Okay? At that point, you always have them come back at 2 weeks. And even if you saw this and it blanched, I would want them to come back in 2 weeks unless you can tell that the patient just had chips and cut it or bit their cheek, or, there's an explanation to this.
Okay.
But if there's no explanation and it still blanches, have them come back in 2 weeks, because you don't know, you could be seeing the beginning of something or the ending of something.
Very good.
But in 2 weeks, your body will clear it if it's at the end of something.
Okay. Very good.
If you ask them to come back in 2 weeks, you set up an appointment, they fail, make sure that you send them a certified letter, because you've got documentation. They either receive it or they don't receive it, but there is documentation that you felt strongly enough as an office that patient needed to come back.
Okay, perfect.
Okay?
Good.
That's for legalities.
Okay.
And basically, that's what it is.
Perfect. That is